mental health. Brought to you by Barber Behavioral Health, a service of Barber National Institute.
We're happy to welcome back Cecilia Hollins with us. She's the Director of Clinical Programming at Barber Behavioral Health. Hi, Cecilia. Welcome back to the Blue Couches.
Thank you for having me back.
And we are talking about a sensitive topic today, but one that is important to talk about.
Right.
September is National Suicide Prevention Month.
Correct. Yep. So as you mentioned, it is an uncomfortable topic, but it's an important topic to be able to have awareness around, but also to be able to have communication around. And so I just kind of want to say from the outset that there's a lot to cover with this topic. So we're going to be discussing it more within the next couple weeks. So what we don't cover today, we'll have a couple weeks to cover.
Yeah. Where would you like to start? Signs and symptoms, things to watch out for?
There's so much. So I think just kind of a little bit statistically, it's likely that everybody at some point in their lives is going to be touched by suicide in some way. Currently, it's the 11th leading cause of death in the United States. And it's the second leading cause of death for children between the ages of 10 and 14, as well as adults between the ages of 25 and 34, and the third leading cause of death for youth and young adults between the ages of 15 and 24. So it's a really serious problem. And so this is not just a statistic, but it's our friends, our family, our neighbors, our coworkers. And like I said, it's probably going to touch everybody at some point.
And obviously we were touched by suicide here, and it's a topic very close to all of us and one we're very close to. So what do you do? What's the first step if you're seeing signs in a friend or a coworker or a family member?
Well, I think first of all, just maybe knowing what some of the risk factors are. So people might be at more risk for suicide if they have a pre-existing mental health concern, depression, anxiety, schizophrenia, you name it. If you've noticed an increase in alcohol or substance use, if that person has access to lethal means, so firearms, prescription pills, knives, or if you've noticed that somebody is just withdrawing and isolating themselves more. On the opposite hand, you might notice that all of a sudden somebody makes a really sharp turnaround and all of a sudden they seem like they're doing really well and they're better. So important to have awareness around that. And I think that if you have concern, the best thing to do is ask. And to offer genuine support to somebody.
I was going to say, is it okay to say, are you feeling like you want to hurt yourself?
Absolutely.
I would never ask somebody that, but I feel like maybe today you should.
Absolutely, it's okay, especially if somebody is noticeably struggling and you're seeing that they're having a hard time maybe seeking that support on their own. It's absolutely okay to ask, and also to ask, like, is it safe for you to be alone right now? And if you are sensing that somebody is at imminent risk for attempting suicide, making sure that you know the resources. So locally, we have Erie County Crisis. That phone number is 814-456-2014. And then we also have the National Suicide Crisis Line, which is 988. And of course, you can always call 911 as well if you are feeling
And
like
as you said, so much to talk about. So we will continue this discussion through the month.
Absolutely.
Right. Cecilia,
Absolutely.
we appreciate it. Thanks
Thank
for
you so
stopping
much for
in
having
today.
me.
Thanks for being here. It is heavy, but that's why we have this segment here. It is a necessary conversation. John, we're going to send it over to you now for a look outside.
Yeah.